Okay, so we've just done the first counselling session, stress management session for the 5 days of treatment. Do you feel now from that session that you have some things to work on and some solutions?
Yes.
So you've got some definite things that you're going to focus on to change.
Yep.
And you've got ways that you can change them.
Yes, I do.
Excellent. Yesterday, your wife said something so complimentary to me, I want you to reiterate. She said,
Remind me.
"Thank you so much for giving me my husband back." So, you must feel really good with the improvement that Rich has experienced in the last 5 days.
Yes, he looks like a different person. He looks very relaxed. His face looks different. His posture is different. And he has confidence.
And he's walking properly, he's making movements that are normal.
Yes. Yeah.
Yes.
Well, you want to start a clinic where you are?
I do. I do want to.
You got my 100% support. Anything, any help you want, I'm right there for you.
Yeah, this needs to go out. People need to listen to you, and they need to just be willing to believe that it's possible for them. Start there.
Right.
That's possible.
Right.
Right?
We already have people in mind that we want to share this with.
Wow.
And we want their lives to change the way that Rich's life has changed.
Right.
So we're very excited
Wow.
about it.
Okay.
We want to take this word out and spread it.
Excellent. Excellent. Okay, so Ronnie, you've been here how many days? 4 days with us.
Yes.
This is the 5th day we're finishing. You just arrived. You're a qualified massage therapist
Yes.
and registered in the state of Florida.
Yes.
And you're also qualified with other stuff, right?
Just different modalities of body work
Bodywork.
is what I consider all of it.
And the spine, you've studied up on the spine.
Myoskeletal, yes.
Myoskeletal. And you actually work at a chiropractor's office.
Yes.
So now that you've worked with me as I'm treating John here, who's your client, what do you think of my approach? It's different, isn't it?
It's very different. It's very different. It's exactly what I think we need, what more people need.
Yep.
I've seen huge changes in him, great changes. I know he has seen those changes within himself.
Yep. Yep, he has improved considerably, hasn't he?
Yes.
Yeah. So, what do you recommend other people have a go at this treatment?
Definitely.
Yep.
Yes.
And do you support my desire to get a chiropractic college to take this treatment in as a program, a program they can teach to other practitioners?
Yes.
Excellent. Good on
Not
you.
just chiropractor, even if you can get into massage schools and do the same thing.
Right. Yeah. Well, that's what I'm going to try and do. Yeah. Righto, Jim. Day 5. This is the end of the treatment. Just had your third chiropractic adjustment. How do you feel?
Absolutely fantastic.
Good. And you're certainly not sorry you came to do the program? Not at all.
No, should have found you 30 years ago.
There you go. That's excellent, mate. Have you got any descriptions of how you improve? This little interview on camera is to encourage other people.
Well, if you want to feel better with life, I suggest come and see you.
Right. Do the
I
program.
don't know how I can put it any plainer.
Right.
I mean, I can't remember, probably I'd have to go back 25 years to say that I felt as good as I feel now, and then I might be exaggerating. See, I might have to go back 35 years even.
Goodness. So you feel that much better?
I feel that much better.
Righto. And as a Christian, you would probably respect the fact that the 6 steps of treatment that I use actually come from the Bible.
Yeah.
So it's good, isn't it? Yeah.
Fantastic.
All right, mate. Thank you very much for travelling all the way from Dalbert in Broken Hill. Thank you very much.
Good now.
Now, Trudy, we're on day 5 of the treatment. You didn't have any obvious symptoms for us to film a before video. Tell me your name and the name of the neurologist who carried out your diagnosis.
My name is Trudy Penman and I was diagnosed originally by Rick Adams at Southport and verified by John O'Sullivan in Brisbane.
And they're both neurologists?
Both neurologists.
All right. You're going home in a couple of hours. How do you feel about what we've done?
I feel like I've got a new life.
You feel like you've got a new life?
Yeah,
She's a new woman.
Yeah, all right. And you feel a lot better now than when you first turned up?
I do.
Okay. Now, Mark, as Trudy's husband, you've seen her develop the symptoms, and how do you feel about the 5 days?
This morning it really hit home to see the back so straight.
Yeah,
After Monday when it was just like the big curve,
yeah.
and then this morning it was just straight as. I just couldn't believe it.
Yeah, it's good, isn't it?
And and even this morning when she does that, her finger's a lot better, a lot
Yep.
faster
Yep.
than it was previous
Yeah.
to this week.
Yeah. All right, guys, thanks for coming. And it's
Thank
been
you.
great knowing you. I've really enjoyed working with you guys.
Before we end the video,
Yep.
Trudy's done a poem up, and I wanted to read it while we're on camera.
Okay, wow.
It's a long one. It was December 2007 when at 38 I was diagnosed with Parkinson's. Mark and I were devastated beyond belief, so to the internet we searched for relief. The biggest medical blunder was what caught our attention, so we made contact with Noel Batten at Warmarin. Noel, who was in America doing treatment, sent us a DVD of his successful clients. To neurologists and doctors we did see, many different drugs we were given with glee. The tremors and rigidity were still present, now with nausea and sleep absent. I showed the DVD to the doctors and chiropractors who said it was not a medical blunder. When contacted by Noel in July this year, the next available time was September, oh dear. The 8th to the 12th of September is a week which I will always remember. We left our 3 kids with family at home, and from Wollongbar to Warmarin we did roam. A week we spent with Noel and Kevin. Massage, chiropractors and counselling, it felt like heaven. You taught me to love myself and smile, to be happy and know my stress and traumas are gone a mile. Now I can relax and enjoy my new life, be a loving person to my family and children and a sexy wife. Noel, you need to know I feel blessed to have met you. Thank you for what you do.
Thank you so much for putting all that time into that. That was excellent. Thank you very much. Goodness me. You surprised me, girl. Thank you so much. Goodness.
It would have been good if I didn't do that. I get
Part of it.
emotional.
It's part of it. Righto, Bart, jog down to the mirrors down there and back again. Relax while you're doing it now.
They got a low door there, he has to duck.
He's so tall.
You what?
All right, now would you have been able to do that on Sunday before I started treating you?
No.
So you're much better than...
Yes.
Yeah. You're happy with it?
Yes. Very happy.
You got any advice for other people trying to make a decision about doing the 5-day program?
Definitely do it.
Definitely do it. Good on you, mate. Before you came from Canada to here,
Yeah.
you would have felt pretty lost, not knowing what to expect.
It's a big step, huge step. I mean, to go, not only the travel time, but the cost, you know, to come down and really didn't know. I mean, I knew you to the extent that I'd spoken with you briefly on the phone. I had watched some of your videos, read your book. So I felt I knew you a little bit, and
Yep.
there was a sense inside of me that this was the right thing to do.
Right.
Yeah,
Okay.
and I did bring it to some people at the church. I obviously brought it to Yvonne initially, and so she had brought good questions, you know, to make sure that I wasn't going off on a tangent, just chasing something in the wind.
Yeah. They do keep us grounded, don't they?
Keep us in check.
Right.
And I appreciate everything. It was really taking a leap of faith.
Yeah, yeah.
I brought it to a couple of men at the church. One in particular said to me, that anybody in the Bible that Jesus healed, it was a leap of faith that they had to take.
Yeah.
You know.
And when I started with you on Monday morning, I did all my tests and asked all my questions. Did you think that I was like digging in too deep into your life and your thoughts and stuff?
No, I welcomed it.
You did?
I welcomed it. It was something that needed to happen.
And then when I did my massage is definitely not a normal massage, is it? It's totally different.
Totally different. It has helped immensely.
Right.
Yeah, immensely.
Now, when I did the strengthening the mind to muscle connection, which is a problem in all Parkinson's MS patients, did you think that was a bit weird?
It was a bit difficult to get my head around initially.
Yeah.
But it made sense.
And it did help, didn't
It
it?
did, absolutely. Oh my gosh.
Yeah.
Absolutely.
And touching certain nerve trigger points while we do that treatment, it's very unique, isn't it? It's a unique approach. It's one of my secrets that I don't even write about in my books.
Yeah, no, absolutely. It's not something I've heard of anybody else ever talking about.
Yeah.
Yeah.
But you know, day one when you came here, you could think a thought to try and move your leg and it just wouldn't move, right?
That's right.
And when we did this particular treatment, that changed that, didn't it?
It changes it, absolutely.
Yeah, yeah.
For sure.
And that's what's missing, even in the natural therapy industry as well as the medical profession. They don't acknowledge that there is an inability to get your thought to move your muscles when you want to move them. And there has to be something specific done, doesn't there? You know that now.
Yes.
In order to enable that.
Yeah, well, I mean, oftentimes you think that and you go, well, it's not happening, so where's the connection? What's missing?
Yeah.
And that was
That was what was missing.
That was what was missing.
Yeah, yeah. So now how much improvement do you feel that you've got over this last 7 days of treatment?
I'd say conservatively, I'm 75% there.
75% there.
75%
All right.
there, yeah.
But
Because I can walk much better.
Yep,
My stamina has improved significantly.
yep,
I can sleep better.
yep.
Some are by the way, are beyond 75%. So I'd say my sleeping pattern,
The stomach pain?
the stomach pain is 95% there. I
Right.
get the odd little twinge.
Twinge every now and again.
Yeah, every now and again, but I mean, I was debilitated with it.
What advice have you both got for people who may be watching this video clip who are considering coming to me for treatment?
The advice I'd give to them is anybody who dismisses it as false, because just like me, a lot of people are basing a lot of their beliefs on what their doctor tells them.
Right.
I'm not suggesting doctors are wrong in a lot of what they do, but I think the paths that they've taken, especially with Parkinson's and MS,
Yeah.
I think they're wrong.
Yeah.
The MS in particular, because the diagnosis I received was very much a doom and gloom diagnosis.
Yeah.
It was, be prepared to get worse. It's called progressive.
Yeah.
They focus on the word progressive.
Progressive.
A
Yeah.
progressive downhill
Yeah.
slide.
Yeah.
Because I'm a Christian, it was an affront to me,
Yeah.
because it was completely against what
What you believe.
my God
Yeah.
is telling me.
Yeah.
And all they wanted to do was give me drugs, although they stopped in their tracks when they
Right.
multiple sclerosis is this big umbrella
Yep.
that covers a myriad of symptoms.
Yep.
And mine is one.
Yep.
So just because I have a leg issue doesn't mean that
All of them are going to
all of them
yeah.
have a leg issue. But it tells me that they're using it as a label
Yeah.
to cover up a whole bunch of things that they don't get.
Yeah, they don't understand
They
what they're saying.
understand.
Yeah. Yeah.
So the only thing that they used to diagnose me was the brain lesions, the
Yeah.
MRI.
Yeah.
It was the only thing that Dr. Bell used. In fact, when we went to see him this last January, a year later, didn't give me another MRI, didn't even ask me to walk, didn't check my pulse, didn't check my neck, zipped. He just sat there in the chair.
Yeah.
And what was interesting, I asked, why are we not doing another MRI? And I said, what if there's more lesions? And he says, sometimes more lesions doesn't have anything to do with the symptoms, so there would be no point. So my
Wow.
question was, okay, so the lesions aren't always associated with the mobility. So how can you diagnose somebody based on lesions when you're saying that doesn't interfere with mobility? So he was kind of contradicting himself.
Yeah.
We won't do another MRI because it won't make any difference, even if there's lesions, because they may not affect him. So
They may not have anything to do with
they may not.
the symptoms you're experiencing anyhow.
Right. So when Dr. Bell diagnosed me in September, end of September 2011, all the way till that, which is over a year had passed, he put a doom and gloom death sentence on me, which I did not what do you say? Accept. But I didn't realize, I didn't accept it at this level.
Yeah, but you
at
did
this
unconscious.
level.
Yeah.
Because he's a doctor.
Yeah.
He's Dr. Bell.
Yeah.
But whatever it did, it so deceived me
Yeah.
of hopelessness.
Yeah.
I didn't realize that that's what he was doing.
Yeah. Now, what have you got to say to other people who may be contemplating doing what you've just done?
Go for it.
Go for it?
Yeah.
You're very happy with what you've learned?
Yes, very much so.
Okay. And Bill, what about you? What's your advice?
Improvements in Sue's been spectacular, I reckon, too.
Spectacular. Good on you.
And how far she's come with her posture and walking and outlook and everything's been great.
Yeah. It's the mental, look what you just said, it's the mental outlook that begins it all. You know, if you can't get that right, I've told people, go home, I'm not interested in treating you anymore, because they they're not interested in putting the determination factor into it, you know, into the
I think
mix.
it's the negative belief systems that culturally and medically you've absorbed.
Right.
And coming into this program, there was a lot of that
Yeah.
sitting there. You
Yep.
know? So
Yep.
I think other PD people who are going through that would be the same.
Yeah. Do you think it's fair that the medical, like doctors and neurologists, tell you all the
I
doom
think
and gloom?
they're coming from where they're coming from.
Right, right.
You know, but there can be a lot of improvement to the way they're treating people.
That's what I think.
A lot of improvement.
Yeah, yeah. All right. A lot of people come to me saying my Parkinson's disease or my multiple
Owning
sclerosis.
something and is not good for you.
No, no,
You need to own the wellness and the wholeness.
exactly. When you first came here, you couldn't jog at all.
No, I couldn't jog at all and I couldn't walk at all very well. No?
All right. Now,
No,
how do you feel now after 5 days?
I'm more confident. Like, if I have to go, I walk, no problem.
And you're happy with the program?
Yes, I'm very happy, very glad.
And your bladder problem's totally gone now?
Yes, yes.
And you can walk up and down
Yeah,
stairs a
I can
lot
walk
easier?
Much better, a lot of easier. The way I turn my neck around is the way I
A lot
walk.
easier?
Yes,
Yep.
a lot easier.
And the tests that I did on you every morning, they're very significant, aren't they? That they told us a lot, didn't they?
Yes.
And have you got any message for other people interested in?
Yes,
Yeah.
do it. of
Do it?
course. I guess everybody, like you have anything to lose, you're just gonna gain coming here, you know.
Right.
You're gonna improve your health. You're gonna just take care of yourself. So that's.
But you've got to be willing to work, haven't you? Got to be willing to do the exercises and put the effort
Must
in.
do everything. We work it together. You know, it's God, you guys, and me. You know,
Yes.
as a team.
Yes,
You know, if he doesn't want,
that's right.
forget.
Yep.
If you don't help him, forget. If I don't help you,
Yeah,
forget. So
exactly.
You need to work as a team.
Yep. Good on you, mate. Before you came to me, did you feel like hopeless?
I did. I
Yeah.
felt hopeless, end of the line. What can I do? The doctors were telling me, they were giving me some choices with the medications, but I couldn't, I didn't want to go with them because they were based on drugs I'd had before that I'd had bad reactions to,
Yep.
or I didn't have enough fat and they'd cause problems, the injecting.
Yep.
And I'd already been through that, so I didn't want to go through that again.
Yep.
So they more or less said to me, well, you'll have to wait until something else comes out. So
Right, right.
it was like, you know, we can offer you nothing.
Yeah.
And I did feel hopeless then. So yeah, by the time I got to you, I felt more hope because the Qigong had sort of helped me in that direction of
So-
easing my tension
Can
and
you-
giving me a bit of control back.
Right.
Because I felt, before that, I felt like I had no control. And I think that's what gave me the courage to come and do this with you.
Right.
Yeah.
So,
It's
is it
normally
right?
I'd be like, oh no, I don't know, it costs too much, and and I'd overthink it all.
Yeah.
Yeah.
Is it right to say that the doctor and neurologist took your hope off you when they?
Oh yeah,
Yeah.
for sure. I'd
Yeah.
lost all hope. The doctors were telling me I'd be in a wheelchair soon, and that was already happening for long distances. If I was going shopping, or I could only walk about 5 metres before I was in pain.
Yep.
Doing this kind of course, I know is a leap of faith. And so I can understand why someone would say, well, that's a lot of money, and you know, it's a lot to spend if it doesn't work, and you know, all the way up there, and I had,
Brisbane, right.
yeah,
Right.
from Tassie,
Yeah.
I had all those thoughts, but because the doctors had given me no hope, I thought, well, I need to take this into my own hands. I need to do something, and I wanted control back of my health and my life. So I thought, no, I'm going to give it a go.
And you've now got that control back?
Yeah, and I've got that control back. I can see from the treatment how much my tension sort of
has subsided. Yep.
and how much of a role it plays in everything as well.
Right.
Yeah.
And the secrets of my treatment that I don't want you to discuss with people, they really work, don't they?
Oh, they do.
Yeah, so what do you have to say to other people who might be contemplating coming to me to do the course?
Oh, I'll say you've got nothing to lose. It's well worth it. It's really helped me. I can really see the improvement. It's given me my hope back and made me feel like I have the power to overcome this. You've given me all the tools now to go home and do that. So I just have to stay focused, like you said.
Yep.
And
you feel good now that you know what to do, don't you?
And I feel good, and everything you've done as explained, you know, it has given me a reason.
Yes.
For, you know, your foot's not lifting because of this blocked nerve.
Yep.
And
yep.
you can't turn your foot out because of, you know, all the other blocked nerves.
Right.
Whereas the doctors don't give you any reason.
Yeah.
You say, well, why can't I do this, or will that get better? And they'll say, oh, no. No.
Yeah.
Or
Your left knee, yep. Now your right knee. There's no way you could have done that on Monday, right?
No.
That's excellent.
Because when we did it, I think I only got there, didn't I?
Yeah. That's excellent. Yeah. Put it there.
I was doing that a bit last night.
Put it there. Final day, you're finally rid of me, mate. all that getting on your back stuff and... Come on, David. Well, I got to tell you, your face looks different. There's a confidence or something about you now. Youthfulness. You made a comment during the week that he's sort of changing.
Mm-hmm.
You can see that.
And you know,
yeah.
I just think he's less, not stressed, but he's not got that constantly concentrating.
Yeah, that's it. Yeah.
Mm-hmm.
So that's good. That's that look tells me I've done my job. So I'm very happy. I'm going to check your spine. I'm going to check the weak. There's only 1 weak nerve reading we got on your cervical spine. I want to make sure that that's okay, or see what it is. Yeah. Now, your experience over the last 6 days of treatment, did you get out of the program what you expected to get out of it?
Oh, very much, yeah.
Very much so. Great. Now, as far as the percentage of improvement that you've gained in the last 6 days, what would you estimate that to be?
It's about the 80, 90. I put that last bit down to just get this right leg strong.
You've got to get the right leg stronger. You've got to do squats, you've got to do flexibility movements.
You know that inner nervousness thing we talked about on the first day? Is it there?
No.
That's gone.
When I relax, I want it.
Alright, so now, can you now see, from all you've learned from us over the last 6 days, can you now see that MS is a disease as in dis-ease? So it does start with the mind, and then the body goes wrong because the mind has gone wrong, and then you just don't know how to get back on track. So the whole process of me finding your personal recipe of causes that got you to where you were, and then reversing them, is really the only way of dealing with this, isn't it? And has it been an easy path for you the last 6 days?
I would say yes. I mean, the discomfort is well worth, that part is something that you just understand that's stress that's been built in there for who knows how long.
Yep. So, alright. All that said, you now have a chance to reach out to other MS patients who might look at me and my information on the internet and wonder, is this guy for real? Is this success really legitimate? What have you got to say to them?
You know, don't be scared. It's certainly, for me, it was within no time I realised that, you know, this is definitely the right thing to have been doing. So,
right.
You know, and as each day has gone on, it's just that whole process in my mind and the results we're getting just have confirmed that it certainly is something that it seems to be the only approach. You know, in this day and age that we can search around the internet and look at all sorts, but I haven't come across anybody else
that's doing this,
putting together something like this.
It's complete, isn't it?
Mm-hmm.
It sort of caters for every aspect of your system: thinking, emotions, stress management, diet, everything. Yeah. Okay, Zdenko, it's day 5 for you.
Yes.
Your walking has improved considerably. Your sleep has improved considerably. Now, yesterday you made a few comments about how impressed you were with everything improving. Tell me about that again.
I walk quite better than on start. Sleep better. I feel more energy. I wasn't so tired like before.
Yep.
I feel better.
All right. Now, I was very impressed with your communication with me before you came to the program. You showed a lot of determination, and that's what I need to see from the clients that I treat, because it's not easy to do this program, is it?
Yes.
It's work, isn't it?
Yeah.
Right.
It's work, yes.
So you came all the way from Slovenia, which is on the other side of the world.
Yeah. It's far away.
It's a long way away.
Yeah.
And that impressed me. Now, what did you think before you came?
I think that you could help me.
Right.
I thought to myself, nothing matters. You have to go there and attend with his treatment. I said to myself, no matter distance, no matter money to spend, I spend that money for me.
Yes. And you're happy that you spent the money?
Yes, yes, I'm happy.
Right. You're happy with the results. When you go back home, you're going to arrive home and you're going to think to yourself, well, that was worth it.
Yes, and I prefer the treatment to my friends. Maybe someone will come to you, maybe here, maybe in America, I don't know.
Yeah. Well, you've asked me for a bundle of business cards, so
yes.
Thank you for that. Now, please remember, this is not just a 5-day program, 5-7 days. It's a 12-month program.
I know.
So when you go home, you have to continue on.
I have to work further.
Yes.
Yes.
Like 3 years since I walked through the door.
3 years since you walked through the door. Wow. So, okay, it took us a while to get here. How do you feel?
Proud.
Proud?
I knew you were going to help me. I just knew you would. Thank you. Thank you so much.
Thank you for inviting us. Thank you for believing in us. You know, we're strangers.
Thank you for believing in me, because everybody hasn't believed in me. And they thought I was crazy to have you here. I'm not crazy.
Oh, no.
I'm not crazy. This is so good. Thank you. Thank you, Jody. Yeah, how will I let you guys go back? I can't.
Okay guys, we've had an absolutely marvellous week.
Yes, we have.
Cheers to a wonderful, gutsy woman. And it's such a pleasure to work with you. Thank you for trusting us and inviting us over here, all the way up here to Calgary, Canada. And Marty, such an amazing husband to support your wife as you have.
Absolutely.
You got some real strength and love between you two guys, and
You do.
it's so motivating for Jody and I to have worked with you and know you. Cheers.
Cheers.
He's back now.
That's more than 15. Okay. Is it gonna burn? Okay. That's good. Jack, you can have a heart attack. Come here, buddy. Holy! Oh my God!
This is the 9th day of my Travel to Treat program with you. You know, you guys have been so good to work with. First of all, I would like to get your feedback on what this experience has been like for you.
Well, for me personally, it was quite an experience. It was like challenge for the brain. I was not understanding things the way I needed to interpret it, and so that was my challenge.
Right. And the fact that I helped you understand how to deal with the world outside the house, and you're thinking about a goal setting and things in the world, it's not sort of subjects you would think would be associated with MS, were they?
No.
Michael, you're a qualified chiropractor. There's your qualifications there from Palmer. And for me, to live in this house with you and work along with you to help your wife, I'm telling you, that's such a blessing for me to know you, to get to know your ethical standards, because I don't see that in a lot of chiropractors. The only chiropractors I choose to take my clients to are chiropractors who have a good ethical standing. I always get them to adjust me first before I bring a client to them to trust them with my clients. And man, you're one of the ones that's right up there.
Oh, thank you.
I've taken my clients to chiropractors in New Zealand, in Australia, in a few different cities, and all over America.
Have fun?
You're in those top 5, mate. And so, as a chiropractor, working with me for the betterment of your wife, what do you feel about the program? How do you like my treatment program?
It's one of a kind. It's like it teaches you not only the massage that you do, but it's the mind work. You don't see that anywhere. Where you get into the cause, and it's all about it's all about working on the brain, and no one's doing that. No one's doing that.
No one's doing it. No.
You're the only one.
Yeah.
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 I mean, her doctor did a little bit of it, but like basically, go meditate, but how do you meditate? Or what are the steps to do this? It's like there's so many ways to meditate. We're confused what to do, and you're teaching us all this stuff.
Yep.
You're teaching us how to be. It's like an instruction manual for the mind.
Right.
That's what it is.
Right.
Yeah.
Right.
It's an instruction manual for the mind. No, if you go anywhere else, I think you'll be wasting your money. You're dead on. You know exactly what to do.
Yeah. So if they go anywhere else, if they've got MS and Parkinson's,
they're wasting their money.
They need to come to me, right?
Yeah, they have to come to you.
Thanks,
yeah.
mate.
Yeah, seriously.
Yeah.
Yeah.
So, as for me, my program catering for all the aspects of the mind-body connection, were you happy with that process?
Oh yeah, because it's every patient is different. It's not a cookie cutter program, and and you put together a formula just for her.
Yep.
It's perfect.
Very individual, very individual.
It is individual, isn't it?
And now she can use this, and she knows how to live.
I know my recipe.
The whole life.
Yeah.
Your recipe, your causal recipe. That's it.
Yeah.
That's the way.
If you don't do Noel Batten's protocol, you're wasting your money. You got all the factors: nutrition, you got the exercises, the massage, everything. If you think you're going to hire Noel and then just sit around for 7 days while he talks, and then you leave 7 or 9 days later or 11 days later, and then it magically goes away.
Yeah, magically. Yeah.
No.
It has to be your design.
I've got a whip, right? I've got a whip.
There's a little boot camp.
It's a boot camp. It is.
No, it
is
has
a boot camp.
Yeah.
Yeah. And you can now also see that even a person who's not sick could do this program and benefit.
I'm benefiting from it.
Right.
Definitely. Yeah.
So as a chiropractor,
yeah,
did you learn stuff off me that's going to help you in your chiropractic?
Oh yeah, definitely.
Excellent.
Yeah.
That's good stuff, mate.
No, definitely.
All right, well, thank you very much, buddy.
All right, thank you, Noel.
Thank you.
Thank you so much, Noel. You're great.
My
Thank
pleasure.
you.
Since the advent of the internet, diagnostic information about Parkinson's disease and multiple sclerosis is being shared abundantly, and people are starting to learn the truth. The lesions showing on an MRI is in no way a sign that a person has either of these two diseases. In fact, around 50% of the Parkinson's and MS patients who have attended my 5-day treatment program who have had an MRI have explained that they had no lesions showing on their MRI. Here are several Parkinson's and MS patients who will confirm this to you. What is the name of the neurologist who carried out your diagnosis?
Pedro Guajardo. He's in Monterrey, Mexico.
Now, did he do an MRI on you?
Yes, he did.
Did he find lesions?
No, he didn't see anything abnormal.
Nothing abnormal on your MRI?
Nothing abnormal.
So then how did he arrive at the conclusion that you have Parkinson's disease?
He asked me to do a couple of things, like to walk, and he saw my face. He concluded that because of the symptoms he was...
From the symptoms, right.
Yes.
And you realise that every symptom that you have can be caused by excess muscle tension and misaligned skeletal...
Yes.
Can you just say your name?
Richard Osborne.
Where do you come from?
Currently living in Huntsville, Alabama.
What have you been diagnosed with?
Parkinson's.
And what is the name of the neurologist who carried out that diagnosis?
Dr. Watts.
And did he do an MRI?
The previous doctor before him had done an MRI.
And did they find lesions?
No.
No lesions at all?
No lesions at all.
Right. Could you tell me your full name?
Shivika Johar,
Where do you live?
Toronto, Canada.
How long have you been in the wheelchair?
2 years.
What is the name of the neurologist who carried out your diagnosis?
Dr. Lee.
Did he do an MRI to see if you had lesions?
He took one MRI when I was diagnosed.
That time in 2008, no lesion
No.
in the brain.
Your first MRI and you had no lesions?
No.
No.
How bad were you at that stage?
Like she was walking, like
holding balls.
Holding walls or with a cane.
Right.
Then they did another MRI in May.
Then they found lesion in the brain.
Many lesions?
No, there is a lesion.
There is a lesion.
There is.
And he took another MRI, still lesions increasing.
Were you in a wheelchair at that stage?
Yeah.
He took another MRI in January this year, 2010, but it was stable.
There was
But
no lesions?
No lesion at all.
Not
He said
one
no.
lesion?
No.
Okay, so now, are you able to stand up on your legs and hold your body weight standing? You can't.
My name is Alba Galeano. I am 66 years old.
And you live in Brooklyn?
Yes.
And you were diagnosed with Parkinson's disease?
April 16, 2009. A general practitioner. His name is Albert Rosso.
Okay. And your neurologist?
Dr. Balderrama,
And where is he from?
Manhattan.
Manhattan, okay.
Yes.
Did either of them do an MRI that showed lesions? Where is that MRI? Here.
So there is a...
It states here, no bony destructive lesion is appreciated. No evidence of intracranial mass effect in this patient with tremors. This is a radiology report, East Manhattan Diagnostic Imaging.
Yes.
Sebastian, what age are you? What age? Sorry? 59. Did they give you a brain scan when they gave you your diagnosis? Did they ever find lesions in the test?
Start with you.
No lesions.
With the paperwork.
Sorry? In the brain or on the spinal cord? No lesions.
How do you pronounce his name? Yes, I know. He's the one we put